So this is a 65 years old male patient, known case of diabetes, hypertension and a chronic smoker, presented with a CAD, ACS and STEMI. The TROP-T was highly positive and with typical chest pain, and on ECG there was a just ST depression in the anterior lead and T inversions, and on echo there was a normal LV systolic function. This is the coronary angiography. You can see the aleocaudal view. There is a significant lesion in the LAD right from the ostium, long lesion, and this left main is very short. You can see in this angio. So we changed the route. This is a right femoral route. So decided to do the angioplasty for this patient right from the ostium LAD. So there is basically two techniques. One is crossover technique, in which you can put the stent right from LM to LAD, and the second is nail the ostium for the ostial LAD, in which we can keep one or two strut in the bifurcation area, and in proximal LAD we put a stent. That is called nail the ostium technique for the ostial LAD. So this patient admitted in the Yojana scheme, so we don't have any imaging in this patient. So we are not going to do a crossover technique LM to LAD. We are going to do nail the ostium technique for this ostial LAD because we don't have imaging in this patient. So ideally we should do with imaging, even if it is nail the ostium or this thing, but we don't have that in this patient. There's an economical constraint, so we have given the option them for the imaging, but they are not willing to do imaging. So we took up this case for the, so with the right femoral root we engaged with the XB3 because the LM was very short, so we took a SB3 into 6 French, and we progressed this BMW PTC wire in the LAD. So the best view to stent the ostial LAD is the aleocaudal view, and this is aleocaudal view, and we took a stent of 3.5 into 28. We wanted to cover this all diseased segment, and the same time we don't want to pinch this diagonal. So the generally bigger stent, big diameter, they won't pinch the diagonal. So this is the aleocaudal view, and this is the placement of stent. We kept the one strut just in the bifurcation area in the, so this is called nailing. So this is the nail the ostium stenting technique. This is the aleocaudal view just to see the positioning of the stent. And then we deployed the stent at 14 atmospheric pressure. Nominal was 10. RBP was 16. So deployed. And this is the picture after deployment. We wanted to do the NC for this patient. So, and the stent is well expanded, but as this is ostial and proximal LAD, we always do the NC for this patient. So we did the NC. So this was the NC balloon of 4 into 10, and this is the NC, and this is the picture after this NC. So this is an angioplasty to the ostial LAD with the nail the ostium technique in this NSTEMI patient. So this was the final shot without wire.